Muy bueno, présteme mejor ese. O déselo acá a la doctora. Sí, para que tengamos otro más y tengamos independencia. Sí,
Yes, we will need another chair. Pass me that one, please.
Oye, para
Good
guardarnos
evening.
una distancia,
We'd like to
tuvimos
keep a
que
safe
hacer un poquito de
distance,
maniobra.
so we've had to
Porque somos
do a
seis.
little
Pero de todos
workaround
modos, muy buenas
here.
noches. Son las 19:01
Good evening.
horas
It's
del
7:01.
jueves 21 de mayo.
It's Thursday,
Estamos en
May
el Palacio Nacional, en
21st.
la Ciudad de
We are
México.
at the National Palace in
Y
Mexico
vamos a
City,
iniciar la conferencia de prensa
and
diaria
we're
sobre la
going to
pandemia de
start our daily press
COVID-19,
conference on the
la epidemia
COVID-19 pandemic,
causada por
the
el nuevo
epidemic
coronavirus SARS-CoV-2.
caused by
Hoy
novel
vamos a dedicarle a dos
coronavirus
temas: el informe
SARS-CoV-2.
técnico diario,
We're
que
going
es
to
el
talk
programa
about
de
two
noticias,
subjects
y
today,
después la parte
the
temática,
daily
luego de un
technical
evento muy
report,
importante
and
que
then
desde hace
today,
varias
as a
sesiones
special feature,
queríamos tratar.
I'm going
Han
to
salido
talk
preguntas,
to you about
inquietudes,
something that
comentarios,
you have
y
asked
trajimos
us
a
about a
la
couple
mayor
of
potencia de
times
nuestras
over the last couple
personas
of weeks.
expertas en la materia,
So
tanto
here we
nacionales
have
como internacionales.
experts,
El tema
both
es
from Mexico
infancia y
and
adolescencia
abroad. We're
durante la
talking
epidemia
about
de COVID.
childhood and
Todo lo que
adolescence
usted
during the
siempre
COVID
quiso preguntar
epidemic.
y no lo había preguntado. Así
So
que yo
everything
trataré de
that
hacer
you
el
want to
introductorio
ask
muy
about
breve.
that and you haven't been
Presento
able to,
a
you'll be able to
las
do it now.
personas que nos acompañan. En el orden de aparición está
I'd
la
like to
doctora
present you
Miriam Veras
to our
Godoy,
guests,
quien es la
Dr. Miriam
directora
Godoy.
general del Centro Nacional
She's the
para la
General
Salud
Director
de la
of the
Infancia
National
y
Center
Adolescencia,
for Childhood
CENCIA.
and Adolescent Health.
Está el doctor Francisco Galán,
We also have
infectólogo
Dr.
pediatra,
Francisco Galan.
quien es el director
He
de los
is a
hospitales federales
pediatrician and
de
he
alta
is the
especialidad,
director
de la
of
Comisión
federal
Coordinadora de los
hospitals
Institutos Nacionales de Salud
and
y
coordinator
hospitales
for health
de alta
institutes
especialidad.
in Mexico,
Bienvenido,
as well as
doctor
specialty
Galán.
hospitals.
Está
Welcome, Dr.
nuestro
Allen.
querido amigo Ricardo
And we also
Burcio
have our
Mújica,
dear
quien
friend,
es
Ricardo
el secretario
Murjica.
ejecutivo del
He
Sistema
is the
Nacional
executive secretary for
CIPINA,
our
para la protección de
CIPINA,
niños, niñas y
for
adolescentes.
our
CIPINA,
protection
que está
for children
sectorizado a la Secretaría de
and
Gobernación,
adolescents
y es
in
el
Mexico.
mecanismo
And this is also
pangubernamental
tied
que
to
coordina todos los esfuerzos en la
the
materia
Ministry
de
of
la
Foreign
protección de
Affairs.
niños, niñas y
And
adolescentes.
here we're
Bienvenido,
talking
Ricardo.
about protecting
Está
children
también
and
Cristian
adolescents.
Escuz, quien es
We also have
la
Christian
persona
Escuz.
titular de la
He
oficina de
is
UNICEF,
the
el Fondo de
head of
Naciones
the
Unidas para la
UNICEF
Infancia en
office
México. Bienvenido,
for
Cristian.
Mexico.
Y también
Welcome,
nuestro querido amigo y
Christian.
compañero
And we also have our
Cristian
very
Morales
dear
Furiman,
friend,
quien es el
Christian
titular
Morales
de la
Furiman,
oficina en
and
México
he
de
is
la
head
Organización
of
Panamericana de
the
la Salud,
Mexican Pan
Organización
American Health
Mundial de la Salud.
Organization in
Bienvenido, Cristian.
Mexico as part of the
Entonces, vámonos con el
WHO.
informe técnico.
Welcome.
Lo haré
Let's
breve
start with our technical
para que
report.
tengamos tiempo de
We're going to make it brief
escucharles
today
a ella
so
y a
that we
ellos,
have
y
time to
también
listen to our
de atender
guests.
preguntas y dar
And of course, we
respuestas.
want to answer
60
all of
días de
your
la Jornada
questions and give
Nacional
you
de
answers.
Sana Distancia.
We have been in our
Recordatorio,
safe distancing
no ha
campaign for
terminado la
60
Jornada Nacional
days.
de Sana
Reminder, it
Distancia.
is not
De aquí al
over.
30 de
Our
mayo,
safe distancing
quédate
campaign
en
is
casa.
not over.
Segundo
From
recordatorio,
now
a
until
partir
May
del 1 de
30th,
junio,
stay at
no
home.
volvemos a lo de
Second
siempre, sino
reminder,
volvemos,
starting on June
transitamos a
1st,
una
we're not
nueva normalidad,
back to
y
the way we
en
used to
la
live.
localidad
We're
donde resides
transitioning into the
va a
new
haber
normal.
cierto riesgo de que se
We're
propague
going to see
COVID,
that there's going to be a
y
certain
en ese
risk of
momento
COVID
tendremos
spreading,
que tomar las acciones
and we're
correspondientes
going
que serán
to
establecidas
have
por
to
la
take the
autoridad sanitaria
corresponding
de cada
actions that have
estado
been
con
pointed out to
anticipación
us
al 1 de
by the
junio,
health
y
authorities
corresponderá
for
al
each
semáforo de
state.
riesgo
And
que
that is going to be
diariamente
according to the
monitoreará
stoplight for
la
risk
autoridad
for each
sanitaria federal.
state. And
Entonces, atentas y atentos, por favor,
each
al
health
momento
authority
de cambio.
in each
De aquí al
state will
30 de
tell you
mayo,
what
quédate
your
en casa.
stoplight color
La
is,
siguiente.
but we want to
En el
remind you,
nivel
stay at home.
internacional, hoy no tuvimos actualización por parte de,
Internationally, we don't
de la Organización
have
Mundial de la
an
Salud respecto a
update
los
from
números,
the
de modo que es lo mismo
WHO with
que ayer presentamos:
respect to the numbers, but they're the
4.789.000
same ones that we
personas
did to you
han
yesterday.
tenido COVID desde el inicio
We
de la
have
epidemia. 25% de ellos, que es
4,789,205 confirmed
1.214.514,
cases,
lo han tenido en los últimos
and we have
14 días. Es la parte activa de la epidemia. Y la tasa de
1,200,514
letalidad global está
confirmed
en
cases over the
6.7.
last
Ha
14
habido un
days.
ligero descenso
The
en los
global
últimos 4 días.
mortality index
La distribución en las
rate is
distintas regiones del mundo
6.7%.
es la que se muestra
You
en
can see
la
in this
gráfica,
bar
con
graph
cerca
what's
del
going on in different
50%
parts of the
de los
world.
casos
We have
residentes
almost
en la
50
región de
of
América.
recent
La siguiente.
cases represented in
En México
America. In Mexico, we have 59,567 people with COVID, and that is since February 28th, which is the day when the first case was recorded. Then we have 12,905 active confirmed cases that have had the onset of symptoms in the last 14 days. 201,838 people have been tested, and then we have 33,291 suspected cumulative cases. And we have all those numbers right here for you to see. Very unfortunately, 6,510 people have lost their lives due to COVID now. And let's remember that all of these numbers are the numbers that we've been able to observe, but there are other numbers that still have to be recorded in terms of people who do not have the serious critical version of COVID. So people who are seriously critically ill with COVID are in hospitals, and then they're registered and they represent these numbers. This is the general prevalence. It's 46.6% per 100,000 inhabitants. These are people who at some point have had COVID since the beginning of the pandemic. You can see on the map where the cases are represented by state and with the darkest color of red. The next slide shows the distribution represented as a bar graph, and here you can see how the Valley of Mexico general area has the largest number of cumulative cases. And let's remember, just as we do every week, we are in the highest transmission phase in the Valley of Mexico right now. Some other areas are in decline in terms of the number of confirmed cases, but we still have the number of cases climbing up. Next, please. Here this shows you the incidence. These are recent case. 12,905 are the confirmed active cases, and you can see on the map exactly where those are represented by state. And that shows you the intensity of transmission as well, represented by different colors. There has been a change in the state of Chihuahua. Right now, in the city of Chihuahua and in the city of Juarez, transmission rates are decreasing. They're going down and they're yellow. And we can see that here as well in this bar graph. The highest frequency of this transmission of this disease is in the Valley of Mexico. Here we see the incidence, and we can compare states. We can see how people with states with more population are darker because there are more people who live there. 10 people out of every 100,000 inhabitants, 10 out of every 100,000 inhabitants have had an onset of symptoms in the last 2 weeks. That is what is contributing to contagion right now. We're looking at the same information here represented as a bar graph. This is an incidence. We can see an incidence of 30 people for every 100,000 inhabitants in City of Mexico, and then Tabasco and other states also represented. This is mortality represented by date and cumulative cases. We show this every day so that you can take a look at what the distribution looks like in this representation. And unfortunately, these people who have lost their lives, we can see exactly by what dates. And those groups of people who have unfortunately lost their lives, who are also being studied to see whether they have died of COVID, and that is in yellow. This is by state, the distribution by state. We've changed the scale of this graph so that today you can see that we've changed that. We can see the bars are a little bit shorter right here, and this is to give more room for what we are showing you and what we're going to show you over the next few days. Finally, these are the confirmed cases as well as the suspected cases in yellow. And you can see this over time. The dates are represented along the bottom of this graph. Here we can see that There is some change, but it is very similar to the last 11 or 12 days over, on average, from when people had the onset of symptoms. And this is a little bit more than representing more than 6,000 people who have lost their lives. This is the epi curve, the cumulative epi curve. And we have 2,973 new confirmed cases. And the percentage there is regarding a progressively greater number each day. So when the number today is, for example, 5.3%, it's with respect to what was there before. So we have 56,000 here, a little bit over 56,000 cases. And you can see that's what this is showing here. Here is the occupancy rate. We have 39% nationally. This is for beds that are occupied. 9,074 beds are occupied, and that is among our network of COVID hospital reporting statistics institutions. Here we see distribution for occupancy rates at hospitals. If we focus on the right-hand side of this graph, we can see a column that has 39% nationally that are occupied and 61% that are available. Let's go over to the left-hand side of the bar graph with our eyes, and we see that 72% of COVID beds for severe acute respiratory illness are occupied in Mexico City, and 28% are available. And you can see the rest of those percentages right there by state. Let's end by taking a look at beds with ventilators. These are people who are critically ill. 34% nationally are occupied. That's over at the far right-hand side of the graph. And over at the left-hand side, you can see Mexico City, which has 64% occupancy rate. But very fortunately, we have 36% availability there. That is our technical report for today. Doctor, I will turn it over to you. Thank you, Dr. Lopez-Gatell. Let's continue with our conference. Excuse me. Thank you. I would like to present to you. This is an official presentation, but with some guidelines for girls, boys, and adolescents. Before I present the information to you, I would like to say thank you so much to the health institutions and to the institutions who have joined us and who collaborated on this document. You can consult this on coronavirus.gov.mx. We gathered this information through our Institute for Adolescence and Childhood, and I represent that, and I am the head of that. And here's the information. Now, in terms of how this regards to what Dr. Lopez-Gatell presents and what he has been presenting, we're talking about people who are under 20 years old. And we see that these people have been affected to a lesser degree. Of the total confirmed cases in general, from what Dr. Lopez-Gatell presented, 1,471 correspond to people who are under 20 years of age. This is 2.5% accumulated. Unfortunately, we have 24 people who have died who are under 20 years of age. We take a look at this with respect to global figures. It isn't a very high number, but it is very important to avoid these deaths at any cost, because children are so young. They have so much life ahead of them. Of these children and adolescents who died, 54% of them were boys. And we can see that there is a distribution that falls in certain states. Here, I'll talk to you a little bit about the document that we created. This is fundamentally aimed at healthcare professionals, because we need to standardize processes for them. The main axis of our document is a focus on epidemiology. The numbers are not they're not that large, but we really have to be clear. We have to be clear about what actions we're taking, and we really want to aim them at doctors because we need to organize our processes and then inform and do outreach with the general population. Clinical work at the moment that it has been published show scientific evidence in their reports. We had three main elements: protection, prevention, and attention to the population that is under 20 years of age. Healthcare professionals have to highlight these elements when we have contact with our population. They have to know when should they get attention, when should they get medical attention. We know that we have to stay at home, but some people who do go to get medical attention, sometimes they go there too late. And this means that the health system does whatever it can, but unfortunately, sometimes people die. In terms of prevention, we've talked a lot about this. Dr. Lopez Gatell has been insisting on this. We have to stay at home, especially children. I know it's very hard because children always want to be jumping around, and parents are saying, oh, let's go to the park and run and play out there and blow off some steam. But we have to look for ways that we can do that at home. The Ministry of Health and other institutions in Mexico have written documents and made guides to help them understand how they can do more things at home with their children. One thing that we've said, the most important thing is to stay at home, wash your hands, sneeze into your elbow, and practice safe distancing. Things that we're going to have to work in our new normal, we're going to have to be working on these daily. We have to avoid direct contact for sure, because it's not just COVID that is transmitted this way, but many other viruses as well. Here, we wanted to help the people do is to identify what's going on with them. Severe acute respiratory illnesses are often caused by diseases or deaths where they have been infected by another illness. But one thing that's important is that people get health attention on time. The first thing to do with your children is take a look at your child. Are they breathing quickly? Are they having trouble breathing? Are their ribs falling in? Are they complaining all the time? Do they have discoloration around their mouths? Do they have a fever that can't be controlled? Is it difficult for them to breastfeed or to drink? And perhaps, is the child very sick? This is something that mothers can feel in their guts. So at that moment, please don't wait. If we're staying stay at home, and we're staying practice safe distancing, but you see that your child is exhibiting these symptoms, you need to get help. And we have a direct telephone line that you can call. But in our guidelines as well, and in our annexes, you can find all the telephone numbers for each state that you can call so that you can ask for help and get medical attention by telephone. This is my last slide. I wanted to point out here something. COVID is the main axis that we're all working around. But there are numerous actions that are tied to other health factors for children within Mexico, children and adolescents. One of these actions are called essential actions. And people who have come to talk with you before have shown you this as well. I'd like you to show you a couple more actions. It seems like we're not doing these things, but we are. And we need to be ready, because if we don't prevent, if we don't do things well, then we might go back to a new normal, but we're going to have a lot of gaps to fill in. The first one is vaccination. We continue to work on vaccinating people right now we're in phase 3 at health institutions, but we do ask people to take a look at those vaccination cards, and if they're missing vaccinations, please do get to a health care facility and vaccinate your child and do it with safe distancing. Here we can see a couple others. Preventing accidents. There are many, many materials, lots of information on that. Then we have neonatal screening. That is very important. Neonatal screening has a big impact on their future. Nutrition, especially for breastfeeding in the first 6 months of life. Mental health, that's very important. We have talked about this a couple of times here. There's a lot of work that has been done and a lot of work that needs to be done. And preventing abuse. Children's and adolescents still get sick from other things besides COVID that can still kill them. This is my presentation. Thank you so much. I'd like to ask Dr. Juan Francisco now to take the floor.
Gracias, doctora Veras.
Thank you, Dr. Averas.
Un dolor de cabeza a veces es
Sometimes it's a headache when we have our moms right on top of us, running right behind us and bombarding us with questions constantly. They're related to how we protect children. Dr. Veras, something that she mentioned, I'm going to pivot off of that. When we're talking about childhood illness or how many children have been affected by COVID, it's not very many. But that doesn't mean that they're not going to get infected. Children, of course, can be infected. And since we are still in this phase of understanding this disease, it's important for us to have alarm signs clear so that we can act on them if we see them. Many people have asked us and said, why are children not affected so much by SARS-CoV-2? There are a couple of theories about why this is true. People have said that children, when they're in their first years of their life, they're exposed to a series of pathogens that are everywhere. They go to their schools or their daycare centers, and there are all kinds of viruses and bacterias circulating around, respiratory illnesses, and others similar to those ones. So children arrive to their pediatrician and you see that they've had contact with all kinds of different microorganisms in their environment. So perhaps because there are so many pathogens competing there's a real competitive niche among SARS-CoV-2 and other pathogens. One theory is that their immune system, the children's immune system, is in process of maturing. What does that mean? It means that slowly, from the moment that they're born up to a certain age, they've been exposed to many different bacteria and viruses, and they start to develop antibodies, and this is a protective system for these microorganisms. So we're born with an immunity that is quite low. And there is an answer from the immune system, but it's not mature enough to be able to have a total clinical coverage that we see in adults. The other thing is that there's a number of receptors, and I think you've talked about this here before, receptors for the virus that are in different cells, and this is what makes up our organisms. So apparently this receptor, which is a converter for diseases in children, and we see that this is happening within their nasal tracts and within their lungs. And that is not working in a way that allows it to receive the virus and then get into the cells and replicate itself. So we know everyone cares so much about Mexican children. As a family, we take very careful care of our children. The other part is that children who get infected or that have been confirmed have SARS-CoV-2, well, 90% of those children won't be exhibiting any symptoms. And those who exhibit symptoms, which are approximately 10% of the cases, they're going to be totally unable to be differentiated from other viruses. For example, influenza, flu, all these other viruses. These other viruses can also infect the children and are circulating as well. So if we do a comparison between flu and COVID, we're going to see that flu hits children and adolescents much harder than it does the adult population. That's why vaccination is so important. It's so important to prevent these infectious diseases. The symptoms that are most commonly exhibited for SARS-CoV-2, fever, dry cough, fatigue, those are very similar to the symptoms that are exhibited by adults, but we can't differentiate them from other respiratory illnesses. So children who arrive to the ICU, who are these children who are hospitalized? These children who arrive to a hospital with difficulty breathing. What are their characteristics? They're males, they're boys. Unfortunately, boys have been hit harder by this pandemic. They have a predisposition that perhaps from infancy has existed. They have complex medical comorbidities, such as being obese, having diabetes, cancer, or immunosuppressive illnesses. And this predisposes them to get this type of infection. For example, children with Down syndrome, for example, have other immunological factors and other factors that affect whether they would get COVID or not, for example, in their organs. Obesity. We have mentioned a lot, we've talked about Mexico and its obese children because we are number one in childhood obesity, unfortunately. The amount of consumption of sugar and processed food that our children consume, it's very high. It's very high. We have to change this. Children who are immunocompromised or have cancer, sorry. Or if they have serious respiratory symptoms, this is another thing that we in children who have been admitted to the ICU with COVID. Many children may be exhibiting fever, maybe 50% of them, and then it's like they put up with it. They don't even cave under it at all. And few of the children who have been in the ICU have needed to be on a ventilator. The children who have needed to be intubated and have respiratory help, the majority of them have managed to get out of it and come out the other side. Fortunately, we have had very few children who have died. Fortunately, we have had very few children who have been affected in this way. And here we can say, what are these cases that have been presented? For example, this disease that is similar to Kawasaki. The disease that is similar to Kawasaki is not an unknown disease. We have seen this in pediatric consultation, but it is very strange to see this.
We still don't know exactly what the triggers are for Kawasaki disease. So it's not just SARS-CoV-2, but other viruses as well also trigger this process. It's basically an inflammatory immunological response. This is how COVID generally presents in children of this age. So what we see in terms of presentation of Kawasaki disease, which has been well established, they have a certain set of characteristics that have to be met in order to be considered Kawasaki disease. In this case, and it's been reported scientifically in 2 reviews or 2 journals on this subject matter, their attention to the number of children who are having these inflammatory symptoms. So on the left, the case that was reported during the month of May this year, and the other one came out in the Lancet, which is a larger journal. So there were 10 cases reported in Italy just within 2-month period. What is the connection? What do parents need to be looking out for? They need to be looking for any spots or rashes, bumps on the skin, and what do they need to do to know whether they should take their child to the hospital? So if they have this characteristic rash, which is, has different shapes, and it can be confused with other skin diseases as well. Another symptom is red palms, as well as inflammation in the ganglia, in the lymph nodes, a raspberry tongue, as they call it, and lips, and as well rash all over the body. What does this mean exactly? So when the child, and it's primarily children under the age of 5, most commonly see cases of Kawasaki, those or the antibodies that 3 or 4 weeks after the infection are triggering these reactions, and it's traveling throughout the blood system. So this inflammatory process is what triggers all of this. It's not really exactly from the virus, but it's an inflammatory response of the body itself reacting to the infection. But these are extremely strict, rare cases that we are seeing. We are seeing some cases, yes, it's possible, but you need to be aware of this. The vast majority of these children get better with treatment, usually IV treatment, taking aspirin, or some cases they might use medication. We especially need to be very careful here about using an EKG to make sure that there's no inflammation of the heart. This is the primary risk that could lead to a death. So this is where I'm going to leave my presentation.
Bien, continuamos con la participación del licenciado Bucio.
Great. Now we're going to continue on with Mr. Bucio, please. Thank you. If you can put up my presentation. Thank you for giving me the time to speak. First of all, here we have April and Julio, who are friends of Sana Distance. We just want to thank the millions of children who are making great efforts to contribute to containing this pandemic. As we've said before, they are the main drivers of environmental protection, of getting adults to stop smoking, and of efficient use of water. And now with the containment of this pandemic. We have 40 million children and adolescents in this country. They are divided into 3 age groups. And for the months of the pandemic, between March and June of this year, more than 717,000 new children will be born. What are we trying to say with this? Just that, as we've said from a health perspective before, the challenge for children in Mexico is not the pandemic, is the invisibility. About 30% of the population we have seen not subject to large public or private issues, but the topics that have to do with children are normally very different. So, for example, adults, we make all the decisions and we all take responsibility for our own children. That doesn't just happen, can't just happen like that. There's an enormous amount of services and institutions, both public and private, that are involved in this effort. Thinking about, for example, nutrition also depends on the food system. So it requires coordinated action by various governments. Why? Because guaranteeing children and adolescent rights can only be done when we all work together, from the municipality to the state to the country, and every sector of the government needs to be working clearly towards this goal, and they need to also get their families to do this. In the comprehensive protection system, what we have done is proposed a set of actions, which we are calling essential actions, to protect children during this period of the pandemic. And so we're trying to address these 4 points: assuring access to services, and I'm going to mention some of them, protecting their integrity, which is against violence and as well their health, avoiding health risks, such as and minimizing secondary or side effects. The head of Global UNICEF said that children can often be the invisible victims of the pandemic. After the pandemic is over, who's going to pay all the costs of these impacts that we've seen, both in public and private life? It's going to be children. So we want to avoid that. Among these essential actions have been divided into 11 areas, and I'm not going to go into all of them, but I want to be clear on the areas of health. As Dr. Vedas presented, there are several areas having to do with healthcare and not just preventing the spread of infection. There are also other aspects involved in that. Children who are born need birth certificates, they need neonatal care, they need sufficient care during birth for them and their mothers, and also to be able to access to public health centers. As well, adolescents need access to justice, immigration services, some who are in shelter systems. They all require adequate attention. So we've prioritized actions such as potable drinking water and hygiene in some of the most at-risk areas, as well as economic supports. We've been provided both the Mexican government and the state and municipal governments to provide financial assistance to families, prioritizing families that are struggling and who have children. It is those children who experience higher levels of poverty, of malnutrition, lack of access to health services, and these are all the multidimensional aspects of poverty. They have constantly been the victims of these shortages. So what do we mean by essential services? And that's every municipal and state government, and of course the federal government. We want to develop a set of indicators to say beyond how many children have died, unfortunately, from COVID. What are some of the other indicators? How are we going to contain having children dropping out of school or child labor? How are we going to prevent sexual abuse of children in these times? 75% of the injuries that children sustain in this country are at home. This is a nationwide statistic. 64% suffer those injuries at the hands of someone who is related to them, and 96% of cases of sexual abuse or of any type of sexual violence are committed against young girls and adolescents. young women. How are we going to prevent also decreases in the public budget envelope for these services? Looking at the child labor rates, we're working with some municipalities at the municipal level. We're working with them because at the federal level, there's already agreement, but at the municipal level, many offices are closed and they need these birth registrations. And also trying to prevent child poverty, as I mentioned before, we also would forecast a decrease in child poverty as well as child malnutrition. With these essential areas, what we are aiming to do is to try and encourage all levels of government along these three lines, so national, state, and municipal. It would be headed by the federal cabinet and then the governors at the state level and civil society organizations as well. This would be happening in all the states and 1,900 municipalities. We're attempting to verify these indicators. We're meeting daily with the executive secretaries, primarily from the comprehensive protection systems in the states and in the municipalities. We're trying to ensure that these services are activated. So this joint responsibility of the entire Mexican state towards children comes from the adult population, from neighboring communities. How can we ensure that if there's a case of violence, when we know that in the house next door a child is being abused and then we don't report that? We have 911 as well as other call lines. So we need to ensure that children and adolescents we are equally responsible for them as a society. Each family, each person needs to take a paternal perspective towards all the children in this country so that they do not go unnoticed. Thank you, Carlos. Now, Christian Morales, if he can now give us his presentation from the Pan American Health Organization. Thank you, Deputy Secretary. Thank you very much for this opportunity to share some thoughts with you. And this is from the Pan American Health Organization about the impact of the COVID pandemic on children. As we said before, one of the primary issues is the invisibility of children during the pandemic. Children are getting sick from COVID. They're getting sick with serious illnesses that are associated with COVID-19, like Cumulative disease, which was explained earlier. They also are dying. We have had a number of deaths in Mexico, and I would like to express my sincerest condolences to the mothers, fathers, siblings, grandparents, aunts and uncles, and cousins of these children. It's a tragedy for Mexico and for everyone. COVID-19 is also impacting children indirectly, not just directly. Indirectly, when their parents or their caregivers are affected and get COVID-19, or unfortunately, if they die from COVID, children are affected. They're also affected when health services that children require beyond health services for COVID, when those other services are reduced. This means there's a decrease in the level of vaccination. If we had a vaccination for COVID-19 today, but for other fatal and potentially deadly diseases, then we wouldn't have the possibility of protecting our children. So these are essential services, and we need to make every effort to maintain those vaccination levels despite the epidemic. Children are also affected on a nutritional level because of their economic situation. They are also affected by domestic violence in their homes. This also impacts them directly as well as indirectly. Next one, please. There are some serious studies that indicate that during the first 6 months of the pandemic, due to direct and indirect causes of COVID-19, more than 1 million children across the world may die. Next one, please. We know what a child needs in order to grow and develop and be healthy. We know what they need for appropriate nutrition, protection, and safety. Learning opportunities in early childhood, good health services, as we just said. Well, the epidemic has and will continue to alter all of that, all of those essential components to a child's development. Next, please. How can we minimize the impact of COVID-19 on children and adolescents? There are a number of actions, and we've shown some of them here, but we can mitigate the effects of social distancing. So we do social distancing to break the chain of transmission with people who have COVID-19, but we can also think about how can we ensure that children are still able to play and have fun and still do it with safe physical distancing. We need to make sure that they're still getting enough exercise, that we can listen to them and console them, assuage their fears, how they can help around the house, and bring them into this dynamic. It's been different for everyone. It's been very difficult for the adults, but of course, even more difficult for children. We can also think about how we can increase development of social protection and education plans. It's something that we've already known, but now we need to apply that universally and much more intensely. We also need to think about how we can implement and intensify certain programs that are directed at children who are in the most vulnerable situations. Those children who are at risk because of their economic situation. Most often, these are migrant children who are passing through our country, and they are more at risk than we might imagine. Next, please. I just want to leave you with this thought from our General Secretary, Mr. Gutierrez. All children of all ages and in all countries are affected, in particular because of socioeconomic impacts, and in some cases, without realizing it, the mitigation measures may be causing more harm than good. This is a universal crisis, and for some children, the impact will last a lifetime. For some kids, this will cost them their lives. Also, right now, in times of saving lives, we need to break the chain of transmission. We need to make every effort thinking about the future in order to rebuild after this outbreak a system that is universal, that receives everyone, and where we get the care that we need, and where the focus is people. The focus is on families, and the focus is on the needs of children and adolescents from within the community and all of those individuals who make up our society in Mexico, in the Americas, and across the globe. Thank you, Christian. Now we're going to go to the last presentation, which is from Christian Scott from UNICEF. Good evening, everyone. We're very grateful for the invitation to participate in this press conference. The child population is not the most impacted by this disease. As of yesterday, we had 1,065 children who had been infected by this disease, and unfortunately 23 have passed away. In addition to the direct impacts, UNICEF has identified other important factors among children and teens, and I want to point out 6 of the most noteworthy. One is childhood poverty, malnutrition and its consequences, domestic violence and abuse, an increase in school dropouts, which we've heard a lot about, and migrant children who are exposed to health risks. However, we can reduce the intensity of these impacts if, as a country, we take the appropriate measures. So we congratulate the Ministry of Health for producing these guidelines for the prevention and detection of COVID-19 among children. And we wanted to point out 3 priority areas. Next, please. First, with regards to food and nutrition and maternal breastfeeding, many Mexicans suffer from malnutrition, and the poverty is affected by the triple load of malnutrition. So it's such as deficiencies in macronutrients and weight issues. Many children suffer from various forms of malnutrition, such as anemia, and many children of school age are overweight or obese. In a situation such as this, it's important to consider that a decrease in food production and an increase in the price of foods thereby reduces the quantity, quality, frequency, and diversity of the food. The consequence is that what children are eating, especially vulnerable families, is not as good. There's evidence that obesity and diabetes and other factors derived from nutrition can increase risks of COVID-19. So this is an issue in which we can all do something. According to the guidelines, it's important to encourage healthy nutrition of this age group. We need to protect maternal breastfeeding for 6 months exclusively and continue up to the age of 2 or older. After 6 months, it's essential to add food and beverages to breastfeeding. According to guideline 3.5 on nutrition and food, it's important for parents to add on a daily basis as many nutritional foods they can, such as fruits and vegetables, to their children's diets, as well as avoiding foods with high levels of sugar, salt, and fat. They also need to ensure adequate hydration with drinking water. It's important to also ensure that they have periods of activity all throughout the national campaign and make sure that children are sleeping enough based on their age. UNICEF is working together with the other systems to strengthen some of these programs to assist with nutrition that primarily affect highly vulnerable children, and as well with the Ministry of Health. We are working on healthy nutrition and breastfeeding. Next slide, please. The second aspect that I wanted to point in terms of impacts on children is related to protecting children against violence and emotional care. At least many children have suffered violence at home. Their stress levels, economic insecurity and food insecurity, unemployment, And restrictions on movement, which have resulted from the epidemic, have reduced the levels of protection towards children and adolescents and increased intra-family violence. Therefore, it is crucial that parents and caregivers get information on how they can handle and manage stress and its impacts on their children, and how they can develop methods that will help them to create and maintain healthy family dynamics. It's also very important for the general public to be aware that if they see signs of abuse and mistreatment, that they need to report them to the corresponding authorities using 911 or other helplines such as Locatel. In order to achieve our results, it's important to ensure that these protection and prevention measures, including psychological protection for children who have suffered violence, these services need to be considered essential so that they are not negatively affected by the austerity measures. Services such as 911, Ombudsman's Office, the prosecutor's offices, and victims' services are essential. It's also crucial to strengthen the referral and channeling services if there's any evidence of abuse or mistreatment once children return to school. Next, please. To conclude, I wanted to talk about the youngest children. In the first 5 years of life are crucial for children as they develop skills and abilities that will be essential throughout their lives. Particularly in the first 3 years is when this development is more intense in the brain. In Mexico, 18% of kids under 5 don't achieve an appropriate level of development, and those are generally one who live in houses with higher levels of poverty, and we don't see the same thing in more well-off households. This means that we need to have services that are more inclusive in terms of our child development programs. We must remember that children who live in poverty and who have shown insufficiencies prior to the pandemic have less access to preschool education and to adequate nutrition. It's important for parents and caregivers, in addition to watching out for their children's emotional and physical well-being during this phase, they must also be able to guarantee access for their children to education during this pandemic period, and if they can't go to school, to learn at home. This is fundamental for the stimulation. Throughout this study and formal learning, children need to be encouraged to play and explore, because that also helps them to learn and develop social and emotional and physical skills. The guidelines describe some useful strategies for creating a calm environment at home and reducing levels of fear and anxiety. So therefore, as my last point, I would like to highlight the importance of providing social support to families with children in order to ensure that there's always an adult at home to teach them, and providing psychological and emotional help measures for parents with young children. So COVID does affect children in many ways, but we can do a lot about it. And so I'm just repeating that we are available to assist Mexico and the healthcare authorities to protect your children. Thank you so much. Thank you, Kristen. So now we're going to pass the floor to the Deputy Secretary, who can talk, so he can moderate the Q&A for the very few minutes that we have. Thank you. We've got 24 seconds left for a question. So we have only got time for one question that must be very summarized and focused, please.
Buenas noches, Liliana Noble de
Good
Puerto
evening,
Saludable.
I'm
Oía
Liliana.
reiteradamente de todos ustedes que hablaban
Today,
de
all of
esta
you
parte de la
who
invisibilidad de
spoke
los
about the
niños frente
invisibility
a
of
la
children with
epidemia, a la
regard to
pandemia.
the
Yo quisiera
pandemic.
saber si la obesidad no existía, claro que existía antes
It's
del
not like
COVID,
obesity didn't exist
y
before
el maltrato
COVID
al
or
familiar y
family
todas estas
abuse.
circunstancias. ¿A
All of
qué
these
se refieren
circumstances
exactamente cuando hablan de esta
existed before.
invisibilidad
So what do you
en la
mean
pandemia
exactly
de
when
los
you're
niños?
talking about
Gracias.
the invisibility of
Querido
children?
diputado, por favor.
Bien, que la mayor parte de la acción de las
Well, the
instituciones
majority
públicas
of
durante
actions
muchos años
for
ha tenido un
public
enfoque
institutions
adultocéntrico,
were
es
very
decir, la
adult-centered.
legislación ha estado pensada para la
So
población
all of the
adulta, los
assistance
servicios
or the
públicos de
public
infraestructura
services,
urbana,
urban
la acción
infrastructure,
del modelo
the
económico, de tal
economic
manera que
model,
no se ha
everything has been
visto
focused on
los
adults,
efectos
but we haven't
negativos que
looked
ha
at the
traído
negative
en la
impacts that that
población
might have
de niños y
on
niñas
the
por no
population of
estar
children.
justamente en la mira. Le
We're
pongo un
not, they're
ejemplo.
not in our
El
sight.
hecho de que
So
México
as
haya
an
crecido tanto en
example,
los
obesity
últimos
has grown
años en la
so much,
atracción del
oh, sorry,
turismo
in Mexico,
hizo
tourism has
también que
grown so
creciera
much in Mexico,
exorbitantemente el turismo
but
sexual infantil.
also
Creció
child
la
sex
cobertura de
trade that
Internet y ha
therefore has
crecido
increased.
enormemente la pornografía infantil. Tenemos millones de
There are
jóvenes hoy que
millions
no
of
estudian ni
youth today
trabajan
who are not
y que no
working or
vimos
going
cuando
to
eran
school,
adolescentes, igual que los jóvenes que están
and
hoy
today
concentrados en
many
actividades
children
delictivas o en centros penitenciarios que
are
durante
not
muchos
involved
años
in
no
recreational
vimos porque no les dimos
programs.
la atención necesaria en la cobertura de
Why?
educación,
Because
en
we
el
didn't pay
sistema de
attention to
cuidados,
them in
etcétera.
the
Es
educational
decir, no
system and in
podemos
our care
seguir siendo un
system.
país
So we
que
cannot
está
continue to be
centrado
a
en un
country that's
enfoque en
focused
donde la
on
perspectiva
an
es la
adult
perspectiva
perspective
con la que se fundaron los estados-naciones
or the
hace
perspective
siglos,
that was
que el
used
Estado
for
se relaciona
centuries,
con la población adulta
that
y
the
los adultos nos
state
hacemos cargo de los niños.
deals with adults and
Toda la
adults take care of
población
the kids. No,
tiene una
the
necesidad de ser
entire
atendida por el Estado
population
y
does
hoy
need
que
to
ya son
be
sujetos formales de
attended
derechos
to
desde el
by the state
2014, las
as well as
instituciones
children. And
públicas tenemos
so
las obligaciones
public
de atenderlos
institutions
en todos
have
los
the
sectores, no
duty
solo es
in
tema del DIF, de
all
educación o de
sectors,
salud,
and I'm
todos
not
los
just talking
sectores de la
about the
vida
DIF,
pública y todos los órdenes de gobierno
every government
desde su primera
entity
infancia.
needs to address children from an early age. The interpreter cannot hear the question.
No es a partir del COVID. Lo que sí
No,
hace
it's
el
not because
COVID
of COVID.
es
What
ayudarnos a
COVID
ver
is
esto
doing
de
is helping
manera
us to
amplia.
see this.
Creo que en ningún momento de la vida del país,
At
al
no
menos
time
los
in
últimos,
our
las últimas
country's history,
décadas,
at least not in the
México se
last
había
few
dado cuenta que
decades,
tiene tantos niños
have
y
we
niñas.
realized
¿Por
that
qué?
we
Porque
have
los
so many
tenemos en
children.
casa,
Why? Because now
porque
we
ahí
have them at
están,
home
porque
all the
estamos
time.
viendo cada una de sus
So now we're
problemáticas.
seeing
Entonces
all
el
of their
COVID nos
problems.
ayuda, como en muchos otros ámbitos de la vida
And
pública,
so
a visibilizar
many other
estas
areas of
situaciones y
society are
tratar
becoming
también
more visible
de
because
poner un
of this.
freno
And so
a
we
los
need to
efectos que
put a
puede tener, que
stop
ya se
to
mencionaron
some
de
of
distintas
these
formas.
abuses and problems that I mentioned.
Gracias, pues son las 20 horas con 2
Thank you.
minutos.
It's 8:02, and so the conference is over. Thank you very much, everybody.
Hey, Laura.
Ah,
Sorry, I was just listening to you on YouTube.
I
And
know, you have to go back and
Ernest.
forth.
Just talking to Laura now. Okay. Awesome.
Great. Okay. How did you feel it went for you?